Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to discuss bone pain after knee replacement surgery. So, what is bone pain, first of all, is it's pain that you're experiencing in the bones. So, with knee replacement surgery, probably the most common is that pain in the front of your shin, kind of the bottom part of your knee and then the shin. Also, you can have pain in your thigh bone or your femur at the end where it connects to the knee at the distal end. And this pain, of course, is just one of the many aches and pains that you can experience after surgery. But why particularly this bone pain? What is the potential cause for this? Well, you want to think about first the surgery itself and how it's performed. So the first step in the surgery, once everything's set up and you're on the table and the knee's opened up, is to make cuts to the surfaces of the knee joint. So this is the end of your thigh bone or your femur. There's cuts made to that part, and then also the top part of your shin bone or your tibia. There's cuts made to that. And why these cuts are made is so that then the prosthetic, the metal components, can adhere to and connect and match up with the bone. And so all this bone cutting or shaving or whatever you want to call it is the first step. Then after that, there's also going to be drilling of these holes, these small holes, into both your femur and your tibia. And this allows for what they call the posts. So these little kind of pegs or these little protrusions that stick out of the prosthetic, again, just to attach onto the bone. So the little protrusions, the posts, go right into those drill holes and attach to the bone, and then either with the cement or the bone heals around the prosthetic, and that allows the adherence of the prosthetic to the bone. So there's a lot of things that are, of course, happening to your bone. The cuts are happening to the surfaces, and then they're drilling one or two holes into your tibia and into your femur. So that's, of course, probably one reason why you have this bone pain. Now, also, after knee replacement surgery, there's going to be different types of strain through the bones. And the reason for this is because, one, there's been changes in the mechanics and the alignment of your knee replacement. So with arthritis is a joint space narrowing type of disease. So the normal knee has good healthy space between the top and the bottom, the femur and the tibia. But with arthritis and breakdown of cartilage, that space narrows, and you can have issues of the alignment of your knee changing. So it might be increased compression in the middle part, or there might be an increased compression in the lateral part. It depends on the breakdown of your knee. But then, with the surgery, the surgeon is going to restore that normal alignment, that normal mechanics of your knee joint as much as possible. And so this means there's going to be different stresses and different strains on parts of the bone that it wasn't experiencing before. And also you're going to have some range of motion limitations, or especially early on after surgery. So you might have some limitations in not being able to fully straighten the knee, or not, of course, being able to fully bend the knee. And that's going to affect your movements when you're walking, when you're standing up, when you're going up and down stairs. There's going to be different stresses through the knee joint and subsequently through the bone itself. Now, of course, there's also the normal healing processes that are occurring. There's going to be swelling and inflammation in and around the knee joint. There's going to be just all the healing processes going on as well. So some pain, some sensitivity in general, added on to what's going on with the bone itself. Now, what can you do about this? Well, before we get there, be sure to subscribe, hit that subscribe button below, turn on the notifications if you're interested in videos similar to this, talking about all things knee replacement, frequently asked questions, exercises, everything else in between. So what we can do about this is that basically you just have to, one, give it time. Your body, your bones, just like everything else in your body, all the soft tissues and structures of your body, have to go through the normal healing process. So there's the first phase, which is that inflammation phase that lasts for a few days to a week approximately. And then there's that second phase, the proliferation phase, and that can last for a couple weeks. And then there's the third phase, which is the remodeling phase, where everything kind of, the connective tissue restructures and the tissues and the cells and everything restructures itself and remodels to what it's going to be long term. And this can go for a year to 2 years long. So it's normal to have some lingering pain, swelling, discomfort with your knee replacement up to a year, up to even a year and a half, 2 years after surgery. Now, for most people, and hopefully this pain decreases slowly over that course of time. It will decrease in intensity, it will decrease in frequency, but it can still be there. Those symptoms can still be there, but hopefully at a much smaller intensity and frequency. And the other thing to do is just continue with your rehab, your recovery, and after you're discharged from therapy, just continue with the regular physical activity and exercise. It doesn't have to be super intense, but just being consistent with it. We want to be able to stress the body, finding that happy medium. So if you think about someone goes to the gym to build strength, well, first we have to break down those muscles. We have to exert stress and strain on them and break down the muscles before we can build them up and build back strength. That's similar with any type of tissue in the body. So giving that adequate stress to promote healing, to promote growth, to promote adaptation, but not too much stress and strain, of course, to cause a flare-up or increased symptoms where you can't tolerate activity. So that's the same with healing of the bones, as well, of course, healing of the muscles and building strength and decreasing swelling and all the important things after knee replacement surgery. I hope you found this video helpful. Again, please be sure to hit that subscribe button and turn on the notifications. I post videos every other day about all things related to knee replacement surgery. And also, please be sure to leave your comments and questions below, and I do my best to get back to everyone I see. Thank you very much for watching.